RAD Corp.
RAD Corporation is an organization that focuses on eliminating health issues around the world. RAD Corp, short for Rid All Diseases, is working towards achieving the ultimate goal in disease control and improving overall health conditions.
Leptospirosis. Although the global burden of leptospirosis is unknown, more than 500,000 human cases of leptospirosis are reported worldwide each year, with a fatality rate of up to 25% in some regions. Leptospirosis affects numerous animal species, including livestock, pets, and wildlife. It can be transmitted through contact of skin, especially if abraded, or of mucous membranes with water, moist soil, or vegetation contaminated with urine of infected animals. Also through direct contact with urine or tissues of infected animals, or inhalation of droplet aerosols of contaminated urine. Leptospirosis are highly motile, and this is achieved by two polar flagella located at each end within the periplasmic space. There's a wide range of symptoms including high fever, headache, chills, muscle aches, vomiting, jaundice, red eyes, abdominal pain, diarrhea, and rash. It's caused by spiral-shaped bacterium, Leptospira interrogans, highly motile, and excreted in urine of infected animals. Leptospirosis imposes two major burdens to humans: the direct burden of illness and medical costs, where available, of course, and an indirect burden due to livestock illnesses.
In China, leptospirosis is nationally monitored infectious disease. The first human leptospirosis case in mainland China can be traced in the 1930s. To date, more than 2.5 million cases and over 20,000 deaths due to leptospirosis have been reported. As seen in the images provided, the prevalence of leptospirosis in southern China is our main focus. We will be targeting a city within the Hainan province to eradicate leptospirosis. In order to improve health conditions, Sanya is a small tourist city in Hainan, which features a relatively lengthy wet season and a relatively short dry season. Lying in the low latitude, Sanya has a tropical oceanic monsoon climate with an average annual temperature of 25.7 degrees Celsius, or 78.26 degrees Fahrenheit. June is the hottest month, with an average temperature of 28.7 degrees Celsius, or 83.66 degrees Fahrenheit, while January is the coolest month, with an average temperature of 21.4 degrees Celsius and 70.52 degrees Fahrenheit. These conditions create an environment suitable for the leptospirosis bacteria. Being surrounded by water increases the risk of infection through contaminated water.
For cost of eradication, the total cost is estimated to be $22,131,772.10. We'll be asking for around $30 million. This money will be going to expenses of the staff, vaccines, and vaccination materials. Staff expenses include transportation and salaries of all 20 nurses and 5 interpreters. Vaccination equipment includes cotton balls, syringes, needles, and alcohol wipes. The lepto vaccination itself costs up to $30. Sanya has a small population of over 22,000 people. We ask for more money than predicted in the case of emergencies or population increase.
Cultural barriers and the government in Hainan province. The main spoken languages of Hainan are Minnan Chinese and Cantonese. The district governing body is the Hainan Administrative District's government under the Guangdong Guangdong Provincial People's Government. To implement our plan for eradication, RAD Corp would ask permission from Government Shen Xiaoming to work in his province and distribute vaccines in one of his cities. With his permission, we would be able to begin working in the city of Sanya.
The vaccine of leptospirosis is limited to certain parts of the world, including Asia. The lack of international reports makes it difficult to evaluate the vaccine. Reports of efficacy is over 70%, little or no side effects, and protection lasting for up to 7 years. Distribution of the vaccine will take place at 3 local health centers in Sanya, including the Hedong Community Center, Sinya Hospital of Traditional Chinese Medicine, and Sinya's People Hospital. There will be announcements via radio and public media communicating to the people of Sanya about the mandatory vaccine and when to get it. The order of distribution is based off the birth month of each resident. A lottery system will be used by the ruler of the town to choose the month. Each birth month is designated 2 weeks to vaccine all the people born in that month. Then the next month will be drawn and announced. This process is predicted to take about 25 weeks based on the distribution timeline. The timeline includes hiring 20 nurses and 3 interpreters, flying the staff out to the Hainan province, shipping the vaccine to the island, and then the distribution months will be announced. Each distribution month will last 2 weeks, the first distribution, and then the second until the 12th distribution week, totaling 25 weeks.